So now we are going to a few very fundamental areas of the preparation. To pass the final MBBS Part 2 is also a very big journey for a lot of students. In fact, the ultimate success in the NEET PG, Foreign Medical Graduate Exam, AIMS PG or PGI, anything, always has a basis from the conceptual level at the undergraduate preparation. So in short future, when the next exam is introduced, the final year exam itself is going to be transformed into the NEET PG and FMGE. So that is the reason, Doctor, I thought some of the very crucial topics in medicine, surgery, gynocs, orthopedics and pediatrics, wherever I get an opportunity, I thought of having a quick revision topic wise. That is the plan. So we will continue our original plan of revising MCQ based discussion, but this is a little premiere for what we have started as the MBBS final year part 2 preparation, quick revision sessions in the 4 subjects: medicine, surgery, gynocs, ortho and pediatrics, 5 subjects. So in pediatrics, one of the favorite questions of the examiner is vaccines, right, doc? So a very common question, many times asked even as an essay question and a short answer is the typhoid vaccine, types, dose, schedule and age of vaccination. So let us clear some of the common basics. Always in vaccination, at least one vial, you should go to the pediatrics department and see the vaccine. You will never forget. So this is a typical typhoid polysaccharide vaccine. Typhim VI typically looks like. This is a typhoid flagellar conjugate vaccine. One single dose pre-filled syringe of 0.5 ml. Similarly, this is a typhoid capsular polysaccharide and tetanus toxoid conjugate vaccine called TypeBar is another brand name. So this is another look of a typhoid vaccine. And also there is a oral vaccine which is available in typhoid, which is called live oral. Type 21A is the vaccine which you need to remember. This is another example of a typhoid vaccine, live oral attenuated TY21A vaccine is a spotter which you need to recognize in the tomorrow's pediatrics practical exam. Now, doctor, where is the typhoid vaccine recommended? Those who live in the endemic areas, the household contacts, the group who are at risk of typhoid, like school children, hospital staff, those who are attending melas, radhayatras, etc., Kumbh Mela, etc. There are 3 types of vaccines in typhoid. Injectable typhoid vaccine, Typhim VI and Typhivax. There is a live oral vaccine which is called Typhoral vaccine and Tab vaccine. So these are the 3 different types of vaccine which are available. Now 1-2 comments about each of them. So you can tell your juniors who have passed their, who recently appeared in MBBS Part 1, that is ENT Ophthalm SPM is over, and who have entered into the MBBS final part 2, that is into medicine, surgery, gynocs, orthopedics, pediatrics.